Good morning, Acton, and welcome to Java with John, hosted by Town Manager John Mangiaratti. Java with John streams every Friday morning at 10 a.m. on ActonTV's YouTube channel. You can also listen live on the radio at 94.9 FM. Tune in weekly for important information from the Town Manager, Health Department, and Council on Aging, as well as a variety of special guests. Residents can contact us with questions or comments at 978-929-6611 or email manager@actonma.gov.
Good morning, folks. Welcome to the Java with John program. We are here today on January 8th, 2021. This is our first program of the new year. Nice to see you all again. And I'm excited to be doing this program again in this new calendar year. It's been a difficult week. This week, you saw what happened in Washington. That was a very upsetting thing for all of us, and I hope that we as a nation can sort through that and be in a better place very soon. But also, last night here in Acton, we again had an issue at the Acton Boxborough School Committee meeting where members of our school committee, black individuals who live and volunteer to be on our school committee, were harassed by someone in a Zoom meeting. And this happened in December, and it happened again last night. And it's something that is unacceptable. And as town manager, I'm going to do everything I can to help our community find a way to stand up against this and find a way to stop it. People that volunteer to work in this town shouldn't be subjected to that, and nobody should be subjected to it. So it's unacceptable, and we're going to work together to sort it out. And I'm sorry to those that were affected and to those that experienced it. So back to what's going on here in town. The pandemic is still very much a part of what we're doing. You saw yesterday, I think might have been the highest day statewide, which is starting to get very concerning. Sheryl Ball will be joining us, or is joining us this morning to talk about what's going on with the latest numbers on cases and some vaccine information. I know there's a lot of questions about the vaccines. We have Sharon Mercurio, the executive producer and Council on Aging director, who is going to be here to share some stuff about what's happening in Senior Center. And we have Saad Dinno of Acton Pharmacy, who's going to talk to us a little bit about what's going on at the pharmacy and what it's been like to run a business in town over the last year during this pandemic. So another good program. We have things happening locally. The town meeting is yet to be scheduled for the year, but it's probably going to be in June. The Board of Selectmen will be discussing it on January 25th. And there will be also some announcements on what the budget process will look like going forward. So stay tuned for that. So if you have any questions about anything you hear today or otherwise, you can always call my office, 978-929-6611, or send an email to manager@actonma.gov. And if you call in during the next 20 minutes, you could even come in and talk during the program. So why don't I go to our first guest, Sheryl Ball, the health director here in Acton, who's been doing a terrific job over the last 9 months, and before that too, who's going to be talking about where we are with the pandemic here in Acton. Sheryl?
Hi, thank you, John. Good morning, everybody. So currently, Acton has 565 cases with 49 in active isolation, with 486 people recovered, and unfortunately, we've had 30 fatalities. Life Care of Acton is currently at 0 cases, and Benchmark Senior Living at Robbinsbrook has 4 current cases. So yesterday, the state released their weekly metrics, and as of yesterday, Acton is currently listed in the yellow community, which means with our population that our case count is greater than 10 cases per week. Our percent positivity rate is currently at 4.03%. So yesterday as well, the governor did a press conference, and as you all know, on December 26th, he had given some further restrictions to help combat the spread. that included both reduced gatherings and reduced capacity for most businesses and offices. So yesterday, the governor extended that order until January 24th. In the past few weeks, my department has been working with all businesses to help them determine their total capacity under this order to ensure compliance. The gathering limit, as you probably know, is currently 10 people for indoor gatherings and 25 people for outdoor gatherings. So what I'm going to be talking about next is something that we're getting a lot of calls about. So I just wanted to let you know that the state has begun distributing vaccine. And as you know, our healthcare workers are in the midst of receiving the vaccine, as well as our congregate care residents and staff. The next part of the first phase will include our first responders, so fire, police, and EMTs. The town of Acton has joined with the Neshoba Associated Boards of Health, and we will be assisting them in vaccinating our first responders. As we progress through the phases, we will be sure to get information out to all of you to ensure that vaccines are given out in the priority as outlined by the state. So just so you know, and you can call us anytime and talk to us about this, but the second phase for the vaccine in this priority order. So the first one I read is the first priority and then so on. So the next phase will consist of individuals with 2+ comorbidities and those that are older than 75 years of age. Early education and K-12 workers would be next. Transit, grocery, utility, food and agriculture, sanitation, public works, and public health workers would be next. And then adult 65+ are after that. And then individuals with one comorbidity will be after that. So this is a plan that we're currently working on. We promise you that once we get this information, we will get it out to all of you ASAP in order to get the vaccines administered. So I know this virus has impacted us in all ways that we've never imagined, and I ask you to remain vigilant and protect yourselves and others. Please wash your hands often, use hand sanitizer when needed, remain at least 6 feet from others, and please wear proper face coverings at all times while in public. Thank you and stay safe.
Thank you, Sheryl. What's the most frequently asked question you get about the vaccine?
The most questions we're getting right now is when can I get it, right? So everybody's eager to get the vaccine, and we know that. And like I said, we're working really hard with the state. We join conference calls. We're developing a plan. So once we can get that in our hands for the next set of people, I assure everybody that we'll get it out as soon as we can.
Okay, thank you. We'll keep everybody up to date. Our first responders are going to start getting vaccinated within the next week or so, and we're going to continue to communicate on a regular basis to let people know about who's next. So thank you. And Sharon Mercurio, what's happening at the Senior Center?
Good morning, John. Thank you, Sheryl, for all your support during the pandemic. It's been fabulous to have a great resource right at our fingertips. So just wanted to do a shout out to Sheryl. We've been busy at the Senior Center, which is great. We really had to rethink how we do everything. I commend my staff on being creative. We had a grab and go lunch yesterday that went really well. On Monday, we're doing a collaboration with the Board of Health. We've gotten a grant through Chana 15. There'll be a 6-week series on mindfulness and meditation. So that starts Monday at 10 a.m. And you can contact Sheryl to sign up for that. We also at 2 o'clock have our very popular program, Words Galore, that did conflict with Java with John last month, but now will be on Monday afternoons at 2 o'clock. At Tuesday, we have one of our own Acton Senior Center participants running a program on cutting the cost of internet, telephone, TV services. Murray Bob has been an active participant here and is one of the members of our computer club. So that is Tuesday at 1 o'clock. On Wednesday, we're having the first of a 2-part series. It's a multimedia program from Abolition to Civil Rights, and that will be at 1 o'clock. Thursday, we're going to be doing a sculpture class via Zoom. So again, really, reaching out to folks, thinking out of the box. Again, want to thank ActonTV for being such a wonderful partner. I know over the time that we've been relying heavily on Zoom, we've been seeing more and more seniors kind of jumping on. We have high school students that are willing to help you with that. But ActonTV is filming and showing so many of our programs on cable as well. So for the folks that may not be comfortable using Zoom, there are still opportunities for them to access classes, lectures, programs via cable. So we try to keep an updated schedule in our newsletter, but also give us a call if you're looking for a program that you can't seem to find. And that's it for me. Thank you very much, John.
Thank you, Sharon. Nice work as always. I'm excited to introduce our next guest, Saad Dinno of Acton Pharmacy. Saad is a member of this community, a big part of this community in West Acton. I know Acton Pharmacy is a local favorite, and we're excited to have him here on the program this morning. I understand that you've owned that business since 1997, but it's actually been around in the community since 1927. So there must be some interesting stories about how this has been a part of our community. Any of those, please, first of all, just introduce yourself to those who may not know you and tell us a little bit about Acton Pharmacy.
First, happy and healthy 2021 to all. Thank you for having me on your program today, John. I'm very appreciative of that. My name is Saad Dinno. I'm a co-owner of Acton Pharmacy. We have 3 other locations in the suburbs in Newton, Concord, and Lexington. My brother and I are pharmacists, obviously. My dad's a pharmacist. My wife is a pharmacist. And I have 7 first cousins that are pharmacists. And my son now is going to pharmacy school and hopefully be graduating in a year and a half. So we love pharmacy. Acton Pharmacy has been here since 1927. It's been part of this community for over many decades, and has played an integral part in providing pharmacy services to a lot of our patients and clients and customers. We've owned the pharmacy. We bought it from the previous owner who owned it since 1965, Mr. Del Canoyer, who was part of the community for many years. We took on a legacy of his, and 22 years later now, we're still here, still strong, providing services that the community needs, whether it's regular retail pharmacy, whether it's making compounding product in our compounding lab, or doing specialty packaging for those that need help with compliance with their medications. So we provide an array of services to the community, and not just to Acton but to the surrounding communities as well. And it's an incredible job. We love what we do. We have incredible loyal customers, John, that have been coming here. It's nice to see the multi-generational family members that utilize our pharmacy, the grandfather, the son, and then the grandkids. And that's probably the best part of is building relationships, long-standing relationships, because that's what it's about, is being a trusted healthcare provider in the community. And we love every day. We love every piece of our business and every customer that walks in through our door.
Yeah, it's a cool spot. I know I've been there a few times, and I enjoy going in there. And it's great to see that you've been able to be successful. And I guess, what has it been like since March? We've all changed a lot of things about the way we do everything. How has Acton Pharmacy adapted, and what's it been like to run a pharmacy through this?
So obviously, as Sheryl alluded, it's unprecedented times. This period has been since early 2020. Obviously, the first thing we did was implemented some barriers to separate us from our customers, to separate the staff from the customers. We mandated obviously masks for all employees, cleaning on the hour, every hour, all the countertops, all the doorknobs, all that things that may perhaps individuals are getting in touch with. We also implemented, obviously we've been, Acton Pharmacy has been delivering for decades, but that has been increased probably twofold. When they can't come, if you can't come to us, we'll come to you. We have parameters set in place where it's contactless deliveries if that's what the customer wants. We also have opened up curbside service. That has been probably the most utilized service out of all, where you'll call ahead, whether it's your prescriptions or over-the-counter products that you may need. We'll bring it out to your car, so you don't have to come into the store at all. And that has been utilized, like I said, a lot by our customers. It's knock on wood, we've been good so far with COVID. Staff have been wonderful. Incredible team that have stepped up to ensure that our services are continued and there's no lag of any service that we provide in any of our departments. I applaud them tremendously for coming to work and taking care of what needs to be taken care of, and that's our customers and patients that need us on a daily basis.
About how many employees do you have over there?
We have about 30.
30?
Yeah.
Wow. That's
Full-time
more than I thought you were going to say.
Yeah.
That's great.
So, then they've been here for a while, most of them. So
that's terrific. So what do you see is next for Acton Pharmacy? Hopefully this whole pandemic winds down soon. And, we can get back to a different operating normal, but what do you see happening there in the community in the future?
So as Sheryl gets calls a lot, we're of course getting calls a lot because we are vaccinators as well, where, we provide many different vaccines, to our patients, to the community, for the flu, pneumonia, or the shingles vaccine and others. So we have signed up with the state and federally to provide the COVID vaccine when it becomes available to pharmacies. Of course, we have to abide as the Department of Public Health and local public health have to abide by the phases. I think that's the number one question is, which phase do I fit in? And, I think we're all still trying to figure it out. And the Department of Public Health comes up with daily updates and so we see ourselves, I would imagine, from next month or hopefully March, April period time to foreseeable future, providing the vaccine to those that need it. I think that's as a community pharmacy, we'll try to play an integral part in vaccinating as much as we can and work with Heather and her team and Sheryl and her team to see how we could be of assistance to the town of Acton and to the community.
So thank you, Saad. So I guess one other question,
Please.
What can we do? What can my office do? What can, Selby, our land use and economic development director, do to help you as a business here in Acton?
Well, I have to say, you guys have always had an open door policy, a phone call away. I'm in contact with Sheryl as we worked in several coalitions with substance abuse and such. So, I think for now, you guys have been an asset to have. You guys have been helpful. The state has been helpful. And if this, I think when it comes to the vaccine aspects, I might be reaching out to you to perhaps work together, collaborate, so we could vaccinate as many people as possible. If our space is perhaps not big enough to do a clinic, we could do appointments one by one, but if there's a clinic aspect, maybe we could work together to provide that to the town of Acton.
Great. Well, yeah, you know how to reach us, please reach out. Actually, it looks like we have a question from the public. This is exciting. And it's for you, Saad.
Yes, sir.
Can I use Acton Pharmacy for my prescriptions if my insurance company wants me to use some of the large chains?
So being part of an independent pharmacy, our fight has been over the past several years is trying to get the exact same contracts as the larger chains. Unfortunately, sometimes they force individuals to utilize a larger chain. You may be able to come to us once or twice or three times, but they sometimes force you to go mail order or a larger chain that's in our area. But that said, individuals can still call their HR department, call their healthcare providers and try to get an exclusion where they don't have to utilize that service. They can stay with us. But we, just for the record, we take mostly 99% of the insurances out there. Some of them have some restrictions, some of them don't. And like all Part Ds we take. So, it just depends on the plan. But like I said, most of the time, 99% of the time, we're able to provide the services that the customer needs when it comes to their prescription needs.
Oh, looks like you're creating all kinds of questions here, Saad. We got another one for you.
Sure.
Is there a cost to get the shingles vaccine?
So the shingles vaccine, it depends on the insurance. That shingles vaccines goes through the Medicare Part D as in David, not Part B as in boy, like the pneumonia or the flu. So it depends on the deductibles. It depends on the insurance. The 99% of the time, I never say 100, but 99.9% of the time it's covered by insurance. For the most part, is a zero copay. But if there's a deductible in the plan, or if that shingles vaccine is included in the deductible, then there'll be a copay. I've seen them most of the time it's zero, sometimes it's 25, and then sometimes it just depends on the deductible that they have remaining. But it's typically a covered product depending on your plan setup. And they can call us ahead of time when we could run it through for them and let them know how much it costs. And it's, of course, as we know, I'm not sure if you know, but it's a two-shot series. So you got to do one, a shot first, and then a shot 2 to 6 months later.
Okay. What's a medicine bubble pack?
So we have a specialty compliance packaging system called Medicine on Time, where if somebody's on, we have people as low as 2 medications or as many as 17, 18 medications that they have to take and figure out during the day. So what we do is we take over and manage that for them, where we put it in a set period of time, like in a morning bubble, we'll call it a bubble pack, which is like a compliance packaging system, like a calendar. I wish I had the package here. I should have had it with me here. But so we set it up for a calendar for the month. And, it's a morning medications together. If there's an afternoon medication, we do it together. If there's a night medication, we do it together. So they get all their medications that they need for that day in a bubble packing system. And it's all dated time, everything has a time and date on it. So they could keep track of when they took the medications. And, we assist with refills. We make changes so that the medications are up to date. There's no questions about what do I take today? What do I not take today? So, it's been a tremendous service. We've been providing it for about 17, 18 years, and it's growing. If there's any questions, please call us. We'll be glad to answer them.
That sounds very helpful. Great. Well, thanks for being here with us this morning on the show, and thank you, Sharon and Sheryl, and thanks to Brian and Mark behind the scenes. This is the end of the program this week, and we will see you next week, same time, same place, and have a good weekend, everybody.